Let's talk about writing learning objectives. So, these are statements describing what the learner will be able to do after participating in the activity. It guides the content development, the speaker selection, and the outcomes measurement. Should be specific, measurable, and achievable, and it should focus on learner behavior, not what the presenter will teach. Let me give you some examples here. So you want to use Bloom's taxonomy. You can Google that to write strong objectives. There's always a diagram. In fact, let me pull one up. So here's one diagram of Bloom's taxonomy. There are many that you can Google, but you want to avoid these lower level recall facts, basic concepts. It doesn't really indicate a change in practice behavior. Whereas as you go up higher, then you will get better outcomes in terms of practice changing. All right. So these are the verbs that you want to use. You can look at these for ideas, but one word that you want to avoid is understand. You see, it's not in any of these verbs here because understand is a very passive thing for a clinician to do. And you see it all the time used as a verb in learning objectives. And it's sort of a highlight of kind of what a newbie writer would use, or like it sort of shows to the client and the pharmaceutical company that this was somebody that didn't know what they were doing because they used the word understand. It's very tempting to use that word, but we must avoid it. So you can use words like implement, differentiate between this and that, compare, appraise. You can have discuss or describe or explain as verbs, but these are sort of lower level again. If you can use words like formulate, treatment plans, construct. So these are the higher level. All right. So definitely look at that when you're writing your learning objectives. And here's a list here too. So many learning objectives stop at low levels, as I've mentioned. Aim for practice changing learning objectives. And here are some examples. So here's a poor one. So understand the guidelines for stroke management is very passive and doesn't result in practice change. Better one to write is apply current stroke management guidelines to acute care scenarios. All right. And then avoid vague or non-measurable verbs like know, understand, or learn, as I've mentioned several times. And you want to align your learning objectives with the identified gaps. So they should absolutely correlate and meet those gaps that we've shown as in that table. That's why that table is a useful exercise to do. And focus on outcomes. Always ask, can this objective be measured as a change after the activity?